Hello, my beautiful people. So, have you ever wondered what makes certain behavior normal and others abnormal? In everyday life, we often label people as strange or different or mentally ill, but psychology uses more precise criteria to understand such behavior. The concept of abnormality helps psychologists distinguish between ordinary variations in human behavior and those that may indicate psychological disorder. To make this judgment, psychologists often rely on the 4 Ds of abnormality: deviance, distress, dysfunction, and danger. These 4 dimensions provide a structured way to identify when thoughts, emotions, and behaviors go beyond what is considered typical or healthy. So now we'll talk about the abnormality. It refers to the pattern of thoughts, feelings, or behaviors that are considered deviant, distressing, dysfunctional, or dangerous. It generally means behavior that deviates from the social norms, causes personal suffering, interferes with daily functioning, or poses a risk of harm. In psychology, abnormality is often contrasted with the normal behavior, but it is important to remember that what is considered abnormal can vary across cultures, societies, and time periods. The concept of abnormality in psychology helps determine whether a person's behaviors, thoughts, or emotions can be considered normal or abnormal. So now we'll talk about the first D, that is deviance. It is the behavior, thoughts, or emotions that deviate, that is, from the society and the cultural norms. For example, what is considered normal varies across the different cultures and times. When someone's behavior goes far beyond what society considers acceptable is seen as a deviant or the abnormality. For example, talking to oneself in public when no one else is around may be viewed as deviant or abnormal by the society. Or a person hearing the voices that others cannot hear is showing behavior that make them abnormal according to the social norms. So now the second D is distress, behavior or emotion that cause significant suffering or unhappiness to the individual. For example, if a person experiences deep emotional pain, anxiety, or sadness that interferes with the daily life, it can be the sign of abnormality, even if the behavior appears normal to others. For example, a person with depression may feel persistent sadness, hopelessness, and worthlessness, causing severe emotional distress, and the people, they can categorize them as the abnormal also. So someone with a phobia may experience intense fear when exposed to certain object or situation that can also be considered as the abnormal behavior. Now the next D is dysfunction, the behavior that interferes with person's ability to function normally in daily life, at work, in relationship, or in self-care. For example, even if a behavior does not cause distress or deviate from the norms, it can still be abnormal if it disrupts your daily functioning. For example, here, someone with OCD, that is obsessive compulsive disorder, might spend hours checking locks or washing hands, making it hard to work or socialize, and that will be considered as the abnormality. Or a person with severe anxiety may be unable to attend classes or maintain a job, and again will categorize them as abnormal people because of this dysfunction. Now the last D is danger, the behavior that can be dangerous to oneself or the others. Abnormality can also be identified when an individual's behavior poses a risk of harm. For example, a person with the suicidal thoughts may be in danger of harming themselves or maybe others, and this can be considered as again abnormal behavior. Or someone with uncontrolled aggression might pose a danger to others, and this can also be considered as abnormal behavior. And these 4 Ds, they can help understanding the concept of abnormality or disorder. I hope you like this topic, and if you like this topic, you can always give your feedback and subscribe my channel. Thank you and have a nice day. Now the last D